Human Services, Education, and related agencies will now come to order. There are an estimated 270 million cell phone users in the United States, about 4 billion worldwide. I would venture to guess that almost everyone in this room uses a cell phone on a regular basis, and most of us don't give a second's thought that it could harm us in any way. However, a growing number of experts think there is cause for concern. The amount of radiation emitted by cell phones, albeit is small, billions of times, I'm told, less than an X-ray, but some researchers believe that over the course of many years, even this low level of radiation could cause cancers of the brain and central nervous system, as well as a range of other harmful effects. Indeed, some international studies have suggested that people who use cell phones for more than 10 years are more likely to get tumors on the side of the head where they usually hold their phone. Other studies, meanwhile, have found no correlation at all. So it is not the intention of this subcommittee to create undue alarm. But one thing that we'll want to discuss today is whether we need more NIH research in this area and how that research should be conducted. Our expert witnesses will also discuss whether there are precautions we should be taking now to reduce our exposure to cell phone radiation in case these fears turn out to be well-founded. I'm reminded of this nation's experience with cigarettes. Decades passed between the first warnings about smoking tobacco and the final definitive conclusion that cigarettes cause lung cancer. If more people had heeded those early warnings, or if we could have established the link between tobacco and cancer more quickly, many lives would have been saved. We don't know yet whether cell phone radiation poses a similar danger. I hope today's hearing will begin to address that question. And before we turn to our first panel, I would yield to Senator Specter, who I would state for the record requested this hearing. It was Senator Specter who came to me and got my attention on this and suggested that we should indeed have a hearing on it. The more I looked in it, the more I think Senator Specter was absolutely right. Senator Specter.
I had to call Senator Harkin on his cell phone to get him, but I was able to get through. I begin by thanking my distinguished colleague for scheduling this hearing. The subject was brought to my attention by a distinguished doctor who's written extensively on cancer, Dr. David Serban-Schreiber from the University of Pittsburgh Medical Center. He wrote a book on cancer, which I found to be very illuminating. I've had a couple of bouts with Hodgkin's and was fascinated to hear Dr. Serban-Schreiber's views about sugar and white flour feeding into cancer. And if you've had chemotherapy a couple of times, you look at any conceivable source to minimize the risk. And when he told me about a conference which is being held, which is underway today on the Senate premises, it seemed, well, he requested the hearing, as did Dr. Deborah Lee Davis, professor from the Department of Graduate School of Public Health at the University of Pittsburgh, that this would be a good day. You have, Mr. Chairman, outlined the issues, I think, succinctly. I think it is worth, in addition, noting that there is a $24 million study underway, which hasn't gotten too far, but is in process. And I think that you are correct that there ought to be a look to see what else needs to be done. I noted a couple of comments. One from the National Cancer Institute, which said, quote, more research is needed to determine what effects, if any, low-level radio frequency has. Well, the question is an open one according to that. And the World Health Organization said, quote, there are gaps in knowledge that have been identified for further research to better assess health risks. And I think it is worth noting that Finland, Israel, and France have taken some action in issuing guidelines for the use of cell phones. So it is something which is worth taking a look at, not in an inflammatory or an excited way or with any stark statements, but say it's a serious question, and a serious question ought to get a serious analysis, and no better place to do it in this subcommittee. So I thank you for convening the hearing, and I thank our distinguished witnesses for coming in.
Well, thank you, Senator Specter. And for the last 20 years we've been working together, I can honestly say that that Senator Specter has always been sort of on the cutting edge of looking at research and, you know, asking the tough questions. You know, should we be doing more research in one area, another area, especially in the area of cancer? I don't think anyone's been more forthright and had strength of purpose for all these years than Senator Specter in pushing the frontiers on cancer research. And so
Senator Harkin and I have not only asked the tough questions, we've provided some big answers, like his efforts and mine having a part, however small, in increasing the NIH budget from $12 to $30 billion over a decade. And in the stimulus package, our efforts adding $10 billion more, which has reawakened a whole research and interest in research scientists with 15,000 grants where funding in NIH with level funding, which then resulted in across-the-board cuts and inflation having taken $5.2 billion out of the 30. So
that's right.
We've done more than provide questions.
We've pulled together. All right. Yeah, pretty good. Thank you. Thank you, Senator Specter. Okay, we'll turn to our first panel, and I will say for this panel and also all the witnesses, your statements will be made a part of the record in their entirety. I would hope that you might sum them up in, let's see, I didn't pencil the paper to figure out our time here, but let's just say 7 or 8 minutes, okay? You can sum it up. I won't have a strict gavel on that, but just try to keep it to 7 minutes or so in your testimony. Our first witness is Dr. John Bucher, Associate Director of the National Toxicology Program, a cooperative effort between the National Institute of Environmental Health Sciences, the CDCP, and the FDA to coordinate toxicological testing programs in the Department of Health and Human Services. Dr. Bucher received a master's degree in biochemistry from the University of North Carolina and a PhD in pharmacology from the University of Iowa. Dr. Bucher, welcome to the committee, and please proceed.
Thank you. Mr. Chairman and distinguished members of the subcommittee, I'm pleased to appear to discuss research supported by the National Institutes of Health, National Institute of Environmental Health Sciences, and the National Toxicology Program on exposure to radio frequency radiation from the use of cellular telephones. I'm John Bucher, Associate Director of the National Toxicology Program. Cellular telephones use radio frequency energy or radiation for mobile communication. Wireless communication devices are used by more than 270 million Americans. With so many users, this could translate into a significant public health problem should their use even slightly increase the risk of adverse health effects. While the weight of current scientific evidence has not conclusively linked cell phone use with any health problems, we and other scientific organizations believe better data are needed to establish any potential risks to humans from the low-level radio frequency radiation exposures associated with their use. The Food and Drug Administration nominated cell phone radio frequency radiation emissions to the NTP for toxicology and carcinogenicity testing. The nomination was based on the following concerns. There's widespread human exposure. Current exposure guidelines are based on protection from acute injury from thermal effects. Little is known about potential health effects of long-term exposure, and sufficient data from human studies to clearly answer these questions may not be available for many years. The NTP is working to provide information that will help clarify any potential health hazards from exposure to cell phone radiation. We're in the initial stages of conducting toxicology and carcinogenicity studies in laboratory animals using specially designed chambers to provide exposures that simulate those of cell phone users in the United States. The rats and mice will be exposed to radio frequency energy from the two technologies, CDMA and GSM, currently used at two frequencies, 900 and 1900 megahertz. Because of the complexity of these studies, we're working with experts from the National Institute of Standards and Technology. NIST scientists have developed a system that provides uniform exposures to radio frequency radiation to unrestrained rodents in the frequency bands used in mobile communications. This design allows for exposures for up to 20 hours per day, in contrast to the most comprehensive rodent cancer studies carried out to date in Europe using restrained animals, where exposures were only to 2 hours per day. The system consists of 21 chambers assembled in Switzerland and installed in IIT Research Institute laboratories in Chicago. The chambers are essentially shielded rooms with a transmitting antenna radiating radio frequency fields and rotating stirrers to generate statistically uniform fields. The NTP is conducting studies in 3 phases: pilot studies to establish field strengths that do not excessively raise body temperature, subchronic toxicology studies where animals are exposed to various subthermal field strengths for 1 month, and chronic toxicology and carcinogenicity studies exposing animals for 24 months. The studies include both sexes of rats and mice and pregnant female rats, allowing us to examine potential health effects from exposures starting in gestation and continuing through old age. The pilot studies are nearly complete. Subchronic studies will begin early next year, and the chronic toxicology and carcinogenicity studies will start in late 2010, finish in 2012, with peer review and reporting in the 2013-2014 timeframe. In addition to the NTP study, research is underway in academic institutions supported through the NIH Extramural Grants Program. The research portfolio of the National Cancer Institute includes several grants examining possible associations between cell phone use and cancer. Internationally, an NCI-funded grant is exploring possible links between exposure to electromagnetic frequencies and tumors of the brain and central nervous system. In the U.S., researchers at 5 academic centers are undertaking the first effort to examine environmental and genetic risk factors for meningioma, a tumor that forms in tissues surrounding the brain and spinal cord. Cell phone use is a major environmental risk factor being considered in this study. These grants are expected to conclude in 2011 with findings available shortly thereafter. The NIEHS is using American Recovery and Reinvestment Act funding to support researchers at UCLA studying whether exposure to cell phones in childhood can affect the central nervous system. The cohort for the study includes over 100,000 Danish children. The research team will study whether cell phone exposures are related to behavioral and developmental problems, as well as outcomes such as seizures, migraines, and sleep disturbances. Thank you for the opportunity to talk about these important studies. The studies I've described represent a significant commitment to determining whether any risks to public health are posed by the use of mobile communication devices. I'll be more than happy to answer any questions you may have.
Thank you very much, Dr. Pryor. I was asking who is the gentleman with you but I understand you're here to try to fix a PowerPoint presentation or something like that. Yes.
Apparently I'm not good enough at that.
It's not working or something, huh? Well, that's all right. Did you have something else, Dr. Booker, that you wanted to...
Now we do have the PowerPoint presentation. We were just going to show some pictures of the, to give you some sense of the magnitude of this operation. These are the chambers that were designed and built in Switzerland and shipped to IIT Research Institute in Chicago. You can see they're large enough to be placed on a crane and dropped through into an underground laboratory facility where they're obviously being received and moved into place. Go ahead, Michael. And then here's a picture of the final series of 21 chambers.
I don't understand what the chambers are for.
These chambers are where the rodent studies are going to be carried out. These are the exposure chambers where the radio frequency radiation will be exposed to the animals.
And you can vary the levels and all that.
Varying levels, yes.
Dr. Bucher, the research you described at the NTP involves animals. I can certainly understand, since we've, in this committee, been involved in working with researchers for many years, I can understand the value of that sort of research. You can subject these rodents to radiation in ways that you wouldn't want to try on people. I guess in these chambers, learn a lot about the basic science. But many other countries are doing studies involving humans. More so, it seems, than here in the United States. We're going to hear later about Interphone, a collaboration involving 13 countries. In fact, practically every study that will be discussed by our second panel of witnesses took place overseas. So I guess kind of a two-part question is, why hasn't there been done so far more been done here in the United States to look at the epidemiology of brain cancer among cell phone users? And why aren't we a part of the Interphone collaboration?
Well, Senator, my understanding is that we do. In fact, NCI does support part of the Interphone study. The Interphone study is a large study in 13 different countries that is supported by, or is being coordinated by, the World Health Organization.
But I don't see the United States. I have the list of them. I don't see the United States listed.
I have a record that we are, in fact, supporting one of the principal investigators on the Interphone study, but I could check that, certainly, and make sure.
Well, I have 13 countries. I just don't see the United States listed. I'd like to know more about that. But go ahead, then. So why aren't we doing more on the epidemiology?
Well, I am not sure I can really answer that question. We have, I've been looking at the grant proposals that have come in to the National Institutes of Health. The one study that I mentioned earlier by Elizabeth Cardis is being funded by the National Institutes of Health, and that is, as I understood it, looking at least some of the cohorts that are being put together for the Interphone study. I do know that the Food and Drug Administration has been working and works with an international work group from Japan, Korea, the European Union, Australia, China, and the World Health Organization. The United States participates in this international work group where they meet every year, I believe, to discuss health effects research on emerging wireless technologies, go over the recent biological research developments, and look at standards developments across the countries. And they also do look into the prospects for international collaboration related to the safety of these devices.
My last question, Dr. Bucher, would be this. You said, and I underlined here, you said that while the weight of the current scientific evidence has not conclusively linked cell phones with any health problems, we and other scientific organizations evaluating the available studies have concluded that better data are needed to establish any potential risk to humans from these low-level radio frequency radiation exposures. Okay, the key words to me are the weight of current scientific evidence has not conclusively linked cell phones with health problems. What does that mean? I mean, is the weight 60-40, 55-45, 90-10, 99-1? What is the weight on this?
Well, I specifically said that better data are needed in my testimony. There have been lots of studies on cell phone radiation. There have been human studies, there have been studies in experimental animals, there have been a wide variety of studies where a variety of tissues from animals and cells from animals have been exposed to radio frequency fields to try to determine whether there are biological effects. And I think that each of these areas with respect to this field have weaknesses, and I think that most people would generally concede that there are weaknesses in each arm of this three-legged stool, I guess, if you would, to provide the weight of evidence. Human epidemiology studies, I think may be currently adequate for looking at events that are fairly closely associated in time with the exposure itself. So you can look at behavioral effects while somebody is actually being exposed to cell phone radiation. You can look at effects on the immune system or something of that nature. But the thing that we're most concerned about is chronic effects, long-term, after long-term use, and things that may take many, many years to develop. A lot of the epidemiology studies that have been done, the Interphone studies, for example, suffer from the weaknesses that all of the participants acknowledge with respect to the fact that they rely on recall of how much one uses a telephone. They rely on, and this in fact introduces some biases that are inherent in these kinds of retrospective, what are called retrospective case control studies. And the other major problem with epidemiological studies at this point is that there have only, as you mentioned in your opening remarks, there's only been 10 or 12 years of exposure to these agents, and it's increasing dramatically. And there have been some hints recently that there is an increase in brain cancers in people who have used these cellular communication devices for a number of years.
Well, thank you very much, Dr. Booker. I'm going to yield down to Senator Specter.
Thank you, Mr. Chairman. You had mentioned children. What are the considerations with respect to an additional potential risk for children using cell phones?
Yes. What was the question?
What is the potential additional risk for children using cell phones? I read in the literature, to give you a little help, that the brain formation in its early stages may raise an additional susceptibility. Is there something to that?
I think with respect to many exposures to many agents, as we study more and more agents and look at different life stages where these agents are being exposed to children or to animals who are...
Well, let's not take up animals. How about children? Is there a significant risk there? I've got 5 minutes, Dr. Ducher.
Children have a configuration of their skull that does allow penetration of cell phone radiation deeper.
Are you saying there's a potentially greater risk?
I'm saying there potentially is a greater risk. And
what limitations, if any, then, if any parents are watching this on C-SPAN, what should they do?
I wish I had a good answer to that. I think that...
Well, would there be a precautionary approach? I understand some of the foreign countries are recommending that there be a limitation. Is that true? Of
Yes.
use of cell phones?
Yes, that is true.
Would you recommend that?
I don't think we're in a position yet to make that recommendation.
How about the use of earphones to minimize risk?
I think that's a good idea.
How would you do that specifically?
I understand that specific materials such as the Bluetooth configuration do reduce the exposure. That's my understanding.
Okay, would you pursue that question and inform the subcommittee so we can inform the public something more
Yes.
precise?
Yes.
Also with respect to the children, something more definitive. There's a $24 million study underway. Is that adequate, being conducted by the federal agency?
This study is going to address one of the 3 aspects of the research program, and I think from the standpoint of the animal experimental data, it will be a state-of-the-art study, and it will answer...
Sufficient.
It will answer the questions to the best of the ability of that technology.
Should there be studies on humans in the United States as there are elsewhere?
I certainly would suggest that there should be studies on humans, yes.
That would take extra funding?
I believe it would.
Would you give the subcommittee a recommendation on what sort of studies you'd recommend for humans and what the cost would be?
I could do that. I can't do that now. I could do that.
Tomorrow? I know you can't do that now, but do it as soon as you can.
Okay.
The private companies have made contributions to some of the studies. It's my understanding. Are you aware of that and to what extent the private companies are helping?
Yes, to some extent. I know there have been some studies that have looked at the literature with respect to who is funding particular investigators. And the one study that I recall indicated that about 20% of the papers that are published from studies do acknowledge that there is funding from private
well, studies
industry.
Which look at the literature don't really go too far. Are there studies which do research beyond the research which has been done to be put in the current literature?
That's an area that's very difficult to answer. I don't know that I can answer that question.
Okay, could you study that subject and give us a written response?
I will, Senator.
I note in the briefing materials that cell phones should not be used in areas where reception is weak or blocked, such as in elevators or trains. Is that so, and if so, why?
I believe that is correct because the power that's required to reach the cell base station is higher in those situations. Therefore, there's more radio frequency radiation transmitted.
Well, in an elevator, my phone customarily conks out. Is there more frequency which is imposed when I'm in an elevator with my cell phone?
I believe that's the case because the cell phone is still attempting to reach the base station.
Well, the red light went on with our last comments. Would you give us a more definitive answer to that as to exactly what is involved and why there ought to be extra precautions under those circumstances in an elevator or similar circumstances?
I will do that.
Thank you, Dr. Ducher. Thank you, Mr. Chairman.
Thanks, Senator Specter. Senator Pryor.
Thank you, Mr. Chairman. Thank you for your leadership on this. Dr. Bucher, let me ask, you may have covered this in your opening statement, I missed it, but how long will it take you to do your analysis?
For the particular studies that I was describing, the analysis will be taking place in 2013 and we'll be reporting in 2014.
And why does it take so long? Just because it takes that long in the lab to
Well, there is
get data together?
There is about a 3-year time in which the animals will be exposed, and it takes about a year to analyze the study after that.
Will there be any preliminary numbers, or would we have to wait till the end to know where this is going?
It's a 3-phase study, and there will be information available from the first 2 stages earlier than that, but they won't be as definitive with respect to outcomes such as cancer.
Do you know if wireless phones were tested by anyone before they came on the market? Do you know the history of that and, you know, how much testing was done or not done?
With respect to health-related testing, I do not know the answer to that. I can find an idea of that.
I think there'd be a lot of people that would be curious about that to know if anything was done. And my sense is that, you know, there are people who have very strong suspicions about this, but I think we need to look closely at the science and look at the studies, and I appreciate your efforts and what you're trying to do. Are there other studies going on either in this country or around the world that you're aware of?
There are many, many studies still going on around the world, yes.
So in other words, yours won't be the first data that's released. We'll see other things between now and 2013.
I'm sure you will, yes.
Okay. Are most of those going on in the U.S.? Are they going on in other countries? Or, you know?
I don't know the answer to that.
Okay. Thank you, Mr. Chairman.
Thank you, Senator Pryor. Dr. Bucher, again, well, you know I left my cell phone someplace. Get your BlackBerry. So, yeah, I've got one of these. So just from a professional standpoint, we know the science is not quite definitive yet. We know what the weight of it is on that. But if I have a cell phone, and I ask your professional opinion on this, and I was going to talk on it like this, or if I could use this device here, which I plug into it, and then put this in my ear, like this, and hold this away from me, and I could talk here, there's my little microphone here. In your advice, which would be best for me to do?
My understanding is that the position that you're holding the phone now is preferable to up against your head.
Preferable to holding it up to your ear. So you would advise people who might be using cell phones as a precaution, because we don't know the weight, but if they can do this, it would be better to have some kind of device like this.
As I understand it, yes.
Now, as opposed to a Bluetooth. Now, a Bluetooth is an electronic device, and it still receives the electromagnetic low-frequency radiation, unlike this, which just comes through a line. So would this be better than, say, a Bluetooth-type device?
Well, I must admit I do not own a Bluetooth. I was under the assumption that the Bluetooth technology was what you're describing, but I'm incorrect.
That is not Bluetooth. No, this is wired.
Sorry.
It's a wire, a copper wire.
Sorry.
Bluetooth is something that would receive from this device to a Bluetooth without any connection whatsoever. And therefore you would still get the radio frequencies right near your head. Even when you talk into the microphone on a Bluetooth, you're getting the transmission very close to your brain. And on this, of course, it's down here quite a ways away from.
I stand corrected.
Range. But you would say this would be preferable.
Yes.
To use that kind of device.
Yes.
I'm going to ask the same question of the other panelists that come up. I'd like to see what they say too. Okay, well, thank you very much, Dr. Booker. We have to move on. Thank you very much for your expert testimony, and thank you for the work you do at the National Toxicology Laboratories. Thank you, Dr. Booker. And now we'll call our second panel.